Lipodermatosclerosis is classically found on inner aspect of lower extremities above the ankle. Presents a red-brown to violet-brown discoloration with firmness and atrophy, often appearing as an inverted champagne bottle, as you can clearly see in this particular illustration. Hi, hope you guys are all doing good. So welcome to our third part of paper discussion video series. I hope you guys are all ready. So let's start with the first question in this video. There seems to be a question on smart burrs, polymer burrs. So these are self-limiting burrs which are used for selectively removing soft carriers dentin. Let's review some information. So as given by manufacturer, smart burr instruments are constructed of medical grade glass bead reinforced polymer. It's a self-limiting instrument which removes soft carriers dentin and will not cut harder, healthier tissues. And also in one of the articles, PubMed Index, they clearly mentioned that it selectively removes decayed dentin without cutting healthy dentin, as you can see in the illustrations here. I hope this information is helpful. Now let's move on to the next topic. I never expected a question along these lines, but if it were true, I'm really surprised. So what are the components of root? I think the options were enamel, dentin, pulp, cementum. So all of them are components except enamel, as you obviously know. Okay, it's really surprising that you had a very, very basic question. A question at kindergarten level, I must say. Anyways, I was just kidding. So let's move on to the next topic. Inverted champagne bottle. So there seems to be keywords, champagne, repeated 2 times in your question paper, champagne, bubble technique, and champagne, inverted bottle. So let's review this first. So in case of lipodermatosclerosis, right, we find this inverted champagne bottle appearance of leg. So this lipodermatosclerosis is an inflammation of subcutaneous fat, often associated with chronic venous insufficiency. Lipodermatosclerosis is classically found on inner aspect of lower extremities above the ankle, and it's classified into acute and chronic phases. The acute phase presents clinically as pain, redness, warmth, and tenderness, whereas the chronic fibrotic phase represents or presents a red-brown to violet-brown discoloration with firmness and atrophy, often appearing as an inverted champagne bottle, as you can clearly see in this particular illustration. Lipodermatosclerosis is most commonly found in people with underlying poor circulation of legs. So it's often seen in women over age of 40 years and men over age of 70 years. And risk factors include age, immobility, obesity, smoking, family history, and history of deep vein thrombosis or trauma to venous system. Okay, I hope this information is helpful. Also, I got a keyword ANOVA, as we discussed in our classes and study club discussions. I'm sure you're aware of this. Tests of significance as such is a very important topic. So ANOVA, so when we have complex group comparisons, right, we resort to this ANOVA. So analysis of variance, also called as ANOVA, is a collection of methods for comparing multiple means across different groups, 3 or more than 3, isn't it? I hope this information is helpful. If you need any additional information, do let me know. Now let's move on to the next topic. There seems to be a question from forensic odontology with the keywords comparative identification. So basically, in case of dental identification procedures, there are essentially 2 forms, comparative identification and reconstructive identification. So comparative, when you have clues, you will compare and try to identify the deceased individual. Whereas reconstructive, without any clues. Let's review some information. So as you can see, dental identification procedures, there are essentially 2 forms of dental identification. The first one is known as comparative identification. Attempts conclusive identification by comparing the dead individual's teeth with dental records of presumed individual. This is possible when some clue exists about the possible identity of the deceased. The second, reconstructive identification or dental profiling, attempts to elicit the population affinity or race, sex, age, and occupation of dead individual. So this is undertaken when virtually no clue exists about the identity of a decedent. Of interest, I mean, Hitler's death, I heard that they had taken up this comparative identification based on his prior dental records, if I'm not wrong. Okay, right. Now let's move on to the next topic, triage. There seems to be a question on the same. We discussed the same in our study club as well. So color coding. So you can see we have various priorities and then respect to color coding and also what each of them represents. First of all, triage, as mentioned in Bailey and Love, it's derived from the French verb trier, which means to sort. And it is a cornerstone of management of mass casualties. Consider this very, very important. It aims to identify the patients who will benefit the most by being treated the earliest, ensuring the greatest good for greatest number, as you can see in the bottom of this particular slide. So we have various priorities, right? Triage categories, 1, 2, 3, and last. So we can see respect to color coding, red, yellow, green, and black. Red indicates immediate medical need, yellow indicates urgent, green indicates non-urgent, black unsalvageable. And also you can find respect to clinical status and the examples for each priorities or triage categories, right? And this represents triage tags. Okay, I hope this information is helpful. Now let's move to the next topic, Epstein Pearls bonds nodules. So these are the keywords which I received. We already discussed the same n number of times previously in paper discussions, e-classes, study club discussions. Now let's review some relevant information with hope that this will help you in answering your question. And also, we'll review some latest PubMed indexed articles information, which clearly states that there is a need to use a different terminology altogether. So let's look into that. Epstein Pearls. As you can see, left illustration represents Epstein Pearls and right illustration bonds nodules. First of all, Epstein Pearls are cystic keratin-filled nodules found along the mid-palatine raphe, as you can see, probably derived from entrapped epithelial remnants along the line of fusion. Bonds nodules, according to Schaefer's, are keratin-filled cysts scattered over the palate, most numerous along the junction of hard and soft palate, and apparently derived from palatal salivary gland structures. According to one of the PubMed indexed articles, Bonds nodules are keratin cysts derived from remnants of odontogenic epithelium or dental lamina, or maybe remnants of minor salivary glands, almost the same. They occur on alveolar ridge, more commonly on maxillary than mandibular. And also, I found some latest information regarding these terminologies, and let me review that for your convenience. Epstein pearls have been labeled as epithelial debris of tooth follicle, gingival glands of Serre, and as abortive enamel organs on palatine area. On the other hand, Bonds nodules are those found along the buccal and lingual aspects of dental ridges, whereas dental lamina cysts are usually found on crests of alveolar mucosa. Currently, even though these terms are used interchangeably, as you know, currently palatal cysts of newborn are the preferred term instead of Epstein pearls, Bonds nodules, or gingival cysts. As far as I remember, I think I've discussed or reviewed the same a couple of weeks, a couple of months prior, but this is some of the latest information given in one of the PubMed indexed articles, and you can follow the same. I hope it's helpful. Now let's move on to the next topic, champagne bubble test. Again, we've come across this keyword champagne. So as you can see, champagne. So what is this champagne bubble test? So used for detecting hidden canals when you place hypochlorite within the access cavity, as given in Engel. Let's review some information. Sodium hypochlorite can aid in diagnosis of missed or hidden canals. This has been called champagne test. I'm sure all of the endodontists are very familiar, including dental graduates who practice root canals. Following cleaning and shaping procedures, the access cavity is flooded with hypochlorite and solution is observed to see if oxygen bubbles are emanating towards the occlusal table, as you can see in the left illustration. A positive bubble reaction signifies that sodium hypochlorite is either reacting with residual tissue within the missed canal or with residual chelator that is still present within the canal that is being prepared, as given in Engel. Okay, I hope it's helpful. Now let's move on to the next topic. Functional cusp bevel is a keyword which I received. So bevel which is placed in functional cusps, 45 degrees to long axis of preparation. Functional cusp being, as you know, palatal cusp of maxillary teeth and buccal cusp of mandibular teeth. Let's review some information. So These functional cusps, or a functional cusp bevel, is placed on palatal or outer incline of palatal cusp, which should be around 45 degrees to long axis of preparation in case of maxillary teeth. And it is provided to increase the thickness of otherwise thin occluso-axial junction of restoration, which means promotes or increases structural durability. And additional thickness in this specific region is necessary because functional cusp is the one which takes most of the load. That's why it's considered or called as functional cusp, isn't it? So it bears maximum load during mastication. And as we discussed, right, it is prepared on palatal cusps of maxillary and buccal cusps of mandibular posterior teeth. I hope it's helpful. Now let's move on to the final topic of this video. So this is something which we already discussed in our e-classes. So fluoride supplementation, depending upon the age group, depending upon the amount of fluoride that's available in drinking water. So this information is from AAPD website, which you can follow. So amount of fluoride supplementation based on age and amount of fluoride in drinking water according to AAPD. So you can see on the left side, we have various age groups: birth to 6 months, 6 months to 3 years, 3 to 6 years, and 6 to at least 16 years. And on top, you can see if the drinking water has a fluoride of less than 0.3 ppm, or if it is in the range of 0.3 to 0.6 ppm, or if it is more than 0.6 ppm, right? So corresponding amount of fluoride has to be given or supplemented to the child. So as you can see, if the water has more than 0.6 ppm of fluoride, no fluoride supplementation is advocated. Whereas if it is between 0.3 to 0.6 ppm, then between age groups 3 to 6, 0.25 milligrams of fluoride supplementation, 6 to 16 years, 0.5 milligrams. If it is less than 0.3, then we start supplementing right from 6 months to 3 years, starting with 0.25 milligrams, and then 3 to 6 years it's 0.5 milligrams, and 6 to 16 years it is 1 milligram. Consider this very, very important. Okay. So these are some of the topics which I wanted to highlight in this specific video. You need any additional information or any further clarification, just drop a comment and give us at least 24 to 48 hours. We'll respond to your comment and update relevant information in description part of these respective videos. Appreciate your understanding, love and affection. So best wishes and love. Take care. Have a fantastic day ahead.